It's a crisis that's sweeping our nation and one we've been following closely, the opioid epidemic. As you may know, Wilmington is #1 for the opioid abuse in the country. Whether that's heroin or prescription drugs, it's a battle the county continues to fight. But as WWY's Kirsten Gutierrez explains, the stigma surrounding drug addicts is also a large problem and one that cost a Wilmington mother of 3 her life.
Those who have struggled with drug addiction know just how hard it is to get back on your feet. Whether it's getting a job or trying to find housing, having to write down your past on various applications may affect your future. And for one Wilmington woman's daughter, it was too much to handle.
She was found in her car at 8:30 p.m. that night, dead, with the engine still running.
It's been more than a year since Iris Baker's 40-year-old daughter and mother of 3, Zoe, died of a heroin overdose.
The day she died, March 23, 2016, I saw her at 4 p.m. She was very depressed again, and her words to me were, "Mom, all the rejection has gotten to me."
For years, Zoe struggled with mental health issues.
With being able to accept that she was worthy of being loved, that drove her to addiction problems.
In 2004, Zoe began living on the streets, the beginning of her heroin addiction.
It was very hard for me because people would hear about her being living on the street or being addicted to drugs even before that, and throw out comments to me, "Well, if you'd just been a better parent, she wouldn't be in this situation." I had that numerous times.
Baker had Zoe in and out of treatment centers, doing the best she could to help save her daughter. In 2010, Zoe cleaned up her act and stayed clean until 2015. But during all of those years,
she never could, through all of that time, find a job. She couldn't even be on a lease.
It's a sad reality recovering addict Debbie Eden says is a constant struggle for those trying to turn their lives around. She's been clean for 21 years, but says it was a difficult process.
It's prevented a lot of people who are in recovery or people suffering from substance use disorder being able to find housing, being able to find appropriate work. And the stigma is that once an addict or once an alcoholic, always an alcoholic or an addict.
Eden says having to check a box or write in your criminal history creates an unwanted stigma.
People would judge me for being in recovery from using drugs and alcohol. They didn't understand the mindset and thought that I was a bad person or that I had a moral deficiency.
In reality, it was a sickness Eden and Zoe were both fighting.
I mean, we're compassionate to people who have diabetes. We're compassionate to people who have heart disease. Why are we so disgruntled towards people who have drug addiction? It's a disease also.
But for Zoe, she couldn't face the constant rejection.
I think all of the rejection contributed strongly to her feeling of unworthiness. She did not like who she was. She did not like what she had become and knew that there was a lot of stigma.
On her last day, Zoe told her mother,
"And I really just don't see a reason to keep trying because nobody will give me a chance to do what they tell me I should be doing."
People closing their doors before giving her a chance. Eden says it's a part of the growing opioid crisis that needs to be addressed.
Just because I have that in my past doesn't necessarily mean that that's who I am today.
And as for Baker,
as far as societally, I really believe we need more accessible mental health resources, because I believe that a lot of the folks who become addicted are doing so because they are seeking that feeling of normalcy and worthiness of acceptance.
While Iris Baker asked society for more accessible mental health resources, Debbie Eden is asking for more people to show compassion for those who are struggling and those who have struggled. Clearing the stigma, Eden says, is just another step in the fight against the opioid crisis.
All right, thank you, Kirsten.